Early this week, the Minister of Public Health of Cameroon sent a communique to Bafoussam ordering the total quarantine of a certain community health center. And what happened was that one of the samples that had been sent for confirmation in Yaoundé had tested positive. And unfortunately, this person had been hospitalized in that center. He had come in contact with many health professionals, and God alone knows how many other people. So quarantining the health facility was one of the control measures to put the virus in check. Then a few days later, we heard a rumor that one Catholic hospital in Boya had reported a case. Yesterday, I saw a message from that hospital, well, supposedly from that hospital, explaining that they don't have the capacity to tell who is positive or not, but following the guidelines that have been put in place by the Ministry of Health, what they do is that if a patient comes with symptoms and that patient is suspected to be positive for coronavirus, they call the regional hospital. It is the regional hospital that takes that person into quarantine, collects his or her specimen, and sends to Centre Pasteur in Yaoundé. So it happened that in this particular case, the result had come back positive. And so the health personnel that had attended to that particular patient are also now on quarantine. This is the backdrop within which we need to start asking ourselves how protected our health professionals are in Cameroon. It's so disheartening that while speaking with a junior colleague this week, she told me, "Don't bother about it. Only God can save us." So it has gotten to that level where people who wake up in the morning to go and spend the whole day, sometimes days and nights, saving lives, they have now abandoned their own lives to fate because the government under which they work cannot protect them. And I do not share these experiences from just hearsay or hypothetical cases. I have served in the Cameroon Ministry of Public Health. I know what it means to conduct a blood transfusion using the touch on your phone. I have done it. I know what it means to deliver a baby using torches because there is no electricity. I've participated in many. Also, the health worker safety issue in Cameroon is an emotional one for me because you may imagine that, okay, if I used to work in the government, I'm no longer there, why should I care? I care because I am also a teacher. For the past 13 years of my life, I have been training health professionals. I have taught at the Higher Institute of Applied Medical Sciences in Boya. I have taught at Biaka University Institute. I've taught at National Polytechnic University Institute in Bamenda. I've taught at St. Jude's Higher Institute of Nursing and Biomedical Sciences in Bamenda. I've taught in the Faculty of Health Sciences of the University of Bamenda. I have taught in the training school for health professionals in Bonaberi, Douala. So if you want to count the number of people that I have personally accompanied into the health professions, it's going toward 2,000 within the past 13 years. So it hurts. I mean, it gives me nightmares to imagine that all these people are out there risking their lives, risking an infection that is preventable. In advanced health settings like Italy and the United States, up to 20% of health professionals are already infected by this virus, COVID-19, and some are already dying. Of course, we heard of the first medical casualty in China, Dr. Li, the man who discovered this outbreak and eventually died from it. This week, the first emergency physician in America died in New Jersey from COVID-19. If you look at the statistics around the world, you will be saddened. Health professionals are now casualties. Does it have to be so? And the answer is no. And when we talk of protection, has it ever occurred to you that we are not even talking about surgical masks? Yeah, even surgical masks are now as scarce as dog's tears. But if you look at photographs of the way health professionals in developed countries dress up when accompanying or treating COVID-19 cases, you will notice that they are putting on something we call IN95 masks. I'm sure you know how these policemen look like, those ones who move around our towns spraying tear gas and that itching water. The mask that they have on that has a shield, and a transparent shield. I know it's not glass, it's some plastic proof kind of thing. It's not easy to break, but it's plastic. That is what they call an I-95 mask. That is what health workers now use in the face of this pandemic. But guess what? Those ones are nowhere to be found in any healthcare setting in Cameroon. Maybe at Hôpital Général or Hôpital Central in Yaoundé, where the patients who are more equal than other people go. But I've never seen one. Or no colleague has reported having received one from the government. So, why is this issue of health workers so important? They are at the front line of care. The number of doctors in Cameroon is so few that we don't even have up to one doctor per 10,000 patients, people in Cameroon. So if we allow them to die, we will have even fewer. And given that the coronavirus is something that you can catch and hold for quite some time before you ever show signs of being sick, people come to the hospital with the virus, infect health workers. The health workers turn around and infect other patients, then go home and infect their families and communities. So this is your fight. The average doctor or nurse working in a public hospital in Cameroon sees at least 100 patients a day. So if that person catches this virus, he will give it to 100 other people in one day. This is why this is your fight. If you practice the physical distancing measures, if you practice the hygiene measures, if you spread accurate information to educate people about the urgency of implementing these control measures, you will be doing your part to slow down the spread. When you slow down the spread, you're doing your part to reduce the likelihood of a health professional getting this virus and then spreading it to all the other patients under his care and further to the community. So somewhere down the line, we will talk about what we can do as a community to help our health professionals be safer. When it comes to complaining about the government, this is not the time for it. There's no impact in that. We can only identify where the needs are and see what we can do on our own part to stop the further spread of this monster. I am Godfrey Eso. Thank you for watching and sharing this video. Thank you for keeping yourself and your community safe.